The very latest overnight, the White House unveiling a three-phase approach for states to start reopening amid the coronavirus pandemic, some before May the 1st. President Trump says he'll leave it to individual governors to decide what is best for their states. But this morning, at least 16 states, including New York, along with Washington, D.C., have already extended stay-at-home orders either well into May or indefinitely. Meantime, cases of the virus are still rising nationwide, now more than 671,000, with nearly 35,000 fatalities. In a moment, we will speak live with the director of the CDC, but we do begin our coverage with NBC's Peter Alexander at the White House and some more on the president's plan. Hey, Peter, good morning.
Hey, Hoda, good morning. Nice to see you. The guidelines do not provide specific dates or locations. They are recommendations that the White House says were written by the president's public health advisors. With these guidelines, President Trump is effectively outlining for governors ways to consider reopening, but acknowledging that they have the final say on what happens in their states. Still, the president says some states that have not been hard hit should be able to open as early as today. President Trump rolling out his roadmap for reopening the nation's crippled economy, just days after claiming he had total authority to order governors what to do, telling them in a video conference Thursday, "You're going to call your own shots."
We are not opening all at once, but one careful step at a time.
The president giving the states a set of guidelines, a three-phased approach designed to help governors determine how to slowly reopen. To begin, states should see a sustained 2-week drop in coronavirus cases, but the guidelines do not specify what an acceptable level would be. In phase 1, people would still be urged to avoid socializing in groups of more than 10, and schools would remain closed, but restaurants and places of worship could reopen with restrictions. In phase 2, schools could reopen and non-essential travel can resume. Finally, the third phase, only for states that show no signs of a spike as restrictions are lifted, with visits to nursing homes allowed again and offices returning to normal. The president explaining how the stages would affect large venues for sporting events.
Many of them are going to be starting without the fans, so it'll be made for television. And then ultimately, we want to have packed arenas.
Absent from the president's new guidance, any plan to ramp up testing. Dr. Anthony Fauci, one of the president's public health advisors, acknowledging widespread testing remains months away.
By the time we get into the fall, I think we're going to be in pretty good shape.
Many governors are calling on the federal government to help resolve that issue.
I think the president doesn't want to believe that testing is a problem. And it is a problem, particularly if we want to get the country going again.
The president expressing confidence that any new surge in coronavirus cases will be quickly erased.
We've learned a lot. We'll be able to suppress it, whack it.
Dr. Fauci acknowledging it'll be an unprecedented process.
There may be some setbacks. I mean, let's face it, this is uncharted water.
President Trump said nearly 30% of the country has not reported a single new case in the last week, with aides here suggesting that some counties may be able to open before their entire states. The president also brushing off the idea of a new normal when this is all done, insisting Americans will get back to their lives without any restrictions. Savannah?
All right, Peter, thank you. And as the president was outlining that plan, there were protests from coast to coast against those stay-at-home orders. One state that definitely will not be reopening by the end of the month is hard-hit New York. NBC's Gabe Gutierrez joins us from Times Square once again this morning. Gabe, good morning.
Savannah, good morning. Some more positive signs here in New York. ICU admissions continue to drop, but the state's stay-at-home order now won't expire for at least another month. Across the country, states are walking a fine line, trying to reopen their economies amid a public health crisis.
This morning, as the death toll surges past 12,000 in New York, Governor Andrew Cuomo has extended the state's stay-at-home order until at least May 15th.
What happens after then, I don't know. We will see, depending on what the data shows.
Mayor Bill de Blasio says New York City, now facing $7.5 billion in lost revenue, won't start returning to normal until July at the earliest. Across the country, protests are spreading from Texas to North Carolina to Virginia.
I'm out here today because I don't think that the government really has any business telling us what we can and cannot do.
And Minnesota, where there's a strict stay-at-home order until May 4th.
We want the governor to know that we have a voice too, and we are here, and we don't want to be in lockdown anymore.
Like groups of states in the Northeast and on the West Coast have already done, governors from 7 Midwestern states are now banding together to coordinate how to reopen their economies. Ohio now says its stay-at-home order will expire on May 1st with safeguards.
The world that we're going to see is a different world. You're going to see people with masks. You're going to see people where there's a lot of sanitizers.
Los Angeles County has seen 3 straight days of record-high death rate.
Deaths aren't statistics, they are stories. They aren't numbers, they are lives.
And officials there predict all large gatherings could be banned until at least 2021. Some communities on the West Coast that saw the country's earliest social distancing restrictions are now taking small steps to a new normal. In Santa Cruz, California, surfers are catching waves again after beaches and parks reopened.
I'm so excited.
But nearby, counties in the San Francisco Bay Area are still under stay-at-home orders, and some locals are worried crowds might be tempted to congregate.
I think there's the potential that people coming from over the hill from the Bay Area might see it as a free-for-all.
New York City's mayor is now urging residents to lower their expectations for summer, saying it's too soon to tell when beaches, sporting events, and public gatherings might resume. Savannah?
All right, Gabe, thank you. And joining us now, Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention, the CDC. Doctor, good morning to you.
Good morning. Thanks for having me.
It's nice to be with you. The White House, as you well know, announced these guidelines on how individual states and communities can return to normal. Just to state the obvious, this is extremely tricky. It has to be done correctly. I was interested to see a Pew poll that said 66% of Americans are worried their leaders will relax restrictions too quickly. Before we get into the details, big picture, how worried are you about that? How worried are you that this may be done too quickly and risk another outbreak?
Well, Savannah, I think that's why we put out the guidance, to give recommendations of what really the important gating criteria is for individuals to consider. Clearly, really important that the outbreak in these jurisdictions is really declining consistently over a 2 weeks period. We have very good surveillance systems in this country that look at flu-like illness and syndromic surveillance for illnesses like respiratory disease, and we're seeing all of those drop substantially. So there are a number of jurisdictions really that have limited activity, but the critical thing is to let the states look at it, their public health systems, and give them a list of some of the key preparedness activities they need to have, like the ability to do rapid testing for new case identification and contact tracing, their ability to test and diagnose individuals that do present with a flu-like illness. So there's a number of preparation events that the state has to really get in place, that we encourage to be in place as they begin to reopen their state, maybe county by county, maybe state at large. But it's going to be a step-by-step, prudent process.
No question about it. We talked last week, and I remember you said we need to have testing for the virus aggressively employed before you can think about reopening. Are we there yet? Are we there yet anywhere?
I think there's certain jurisdictions that we do. I mean, I think people have to look at what the real strategic role of testing is. And at this point, it's to make that rapid early diagnosis, which then you can affirm and then isolate and then do the contacts, then test, figure out of the contacts who's infected, isolate those individuals, then do their contacts. It's really the traditional public health approach for containment. And I think there's a number of jurisdictions that are very close to having that capability. We're going to work with them. CDC is going to work with all the jurisdictions to try to help them correct those gaps, because it is going to be really critical that you have that public health infrastructure as you begin to loosen up these mitigation restrictions.
Whatever you feel about testing in your particular community, I don't think there's anywhere where you're in the position of anybody who wants a test can get a test. And that kind of raises the question, how do we really get a good picture of where this virus is, especially since so many people display no symptoms at all but can still spread it?
Yeah, Savannah, that's a really important question. I do think the systems that we have that monitor respiratory illnesses are very good. But as you pointed out, what's different about this virus is there is a significant number of individuals that actually are infected that don't demonstrate symptoms. We're establishing a series of important surveillance points, sites throughout this country, focusing on first nursing homes, long-term care facilities. They really, in many of the states, have been the incident cases in their community. We're going to be establishing surveillance sites in some of the inner city clinics that we have and some of the indigenous population clinics to be really looking to try to identify and understand how much asymptomatic infection is there. I will say, though, from a strategic point of view, you're going to know when you need to start to be concerned that there may be asymptomatic infection when you start to see evidence of symptomatic infection. So when you look in certain communities that have absolutely no symptomatic infection, those are not going to be communities where we're going to have asymptomatic infection. So we are increasing the surveillance system across this nation specifically for COVID and specifically to try to understand where asymptomatic infection is.
And then finally, in the few seconds we have left, I know people are happy and people are so anxious to return back to normal life. When you hear those glimmers of hope, you might think, okay, maybe we could kind of take our foot off the gas. Do you have a word about the vigilance that's required in these next couple of weeks?
Yeah, thank you for bringing that up, Savannah. It is really important. I'm very gratified how the American public came together and really embraced the mitigation strategies that we had put out, the 30 days to slow the spread of coronavirus. As I said before, sometimes behavior modification is pretty tough when it's to help improve your own health, but the American public really came together when those mitigation strategies were to protect the vulnerable and others. And we need to be very vigilant in that. This new opening up, which has that requirement of early case diagnosis and isolation and contact tracing, is really embedded, as you'll see in the phases, with still maintaining that personal vigilance, that personal mitigation, so that we can continue to limit and protect the vulnerable in this nation. So it's important not to let up at all, but do this in a prudent, gradual way as we go through the different phases and really maintain those mitigation strategies of hand washing, social distancing, wearing a face covering when you're in public, if you're in an area where there's still significant ongoing transmission like we still see in New York, Boston, obviously Baltimore, Washington, different parts of our nation.
All right, CDC Director Dr. Robert Redfield, thank you so much for your time this morning. We appreciate it.
Yep, thank you, Sue. Thank you.
All right, Hoda, we'll send it back to you.
All right, thank you, Savannah. This has been another brutal week for the U.S. economy, highlighted by another 5 million people filing for unemployment. And in a new hit to so many people in need right now, relief money for small businesses, that's running out. NBC Business correspondent Jolene Kent is in with more on that. Hey, Joe, good morning.
Hey, Hoda, good morning to you. Well, with the economy virtually shut down, so many small businesses like these are hanging signs in their windows saying they're closed until further notice. Meanwhile, the Paycheck Protection Loan Program has already run dry, leaving it up to Congress to come up with more.
This morning, workers and business owners nationwide are desperate for relief. 22 million Americans have now filed for unemployment benefits in the last 4 weeks alone, as more companies like Yelp and Groupon announce thousands of new layoffs. Small businesses are struggling to make it through this pandemic, too. The $349 billion Paycheck Protection Program, designed to keep small businesses afloat and their employees paid, dried up on Thursday. Demand for the forgivable loans was so overwhelming that the Small Business Administration said it processed more than 14 years' worth of loans in less than 14 days.
When it comes to applying for these different grants or programs or whatnot, it's stressful because they keep changing the rules.
Demetrius Ennett runs a barbershop near Dallas. He applied for a loan through his bank earlier this month, but still hasn't heard back.
I'm scared that this could potentially kill my business. And I worked hard to build this business from the ground up.
The Small Business Administration says 1.6 million loans have been approved, but it stopped accepting new applications. Sandy Locke runs Bully Brew Coffee in Minnesota and South Dakota. Business is down 80%.
I was sick to my stomach, like doing numbers and going, okay, how long can I do this? It's survival mode.
Luck says she was forced to close 2 of her coffee shops and laid off 24 employees. Fortunately, last week, her government loan came through, and she's been able to hire back some of her staff.
How long is that going to last you?
So we have 8 weeks with that funding. And then after that,
As for your individual relief money, the Treasury Department now says 80 million people have received that funding. If you had that IRS registered direct deposit information, you can check the status of your money as well on a website called Get My Payment, though there's been so much traffic on that it has seen some problems here. But if you are waiting for that paper check, it could still be weeks or longer. Hoda.
All right, Jolene Kent for us on that story. Thank you, Joe. All right, so what do you say, guys? We turn to the weather and Mr. Roker. It is the weekend, Al.
It is the weekend. You ready for a little weekend snow, little weekend winter? Because if you are, I got a great forecast for you. Check out the radar right now. Yes, it's coming, baby. And for the Northeast as well. Look at this. From Iowa to Chicago into Ohio, we are looking at some light snow, rain and heavy rain through central parts of Illinois. We've got right now 24 million people affected by this system as it pushes to the east with winter weather advisories. Snow zipping across the Great Lakes into New England later today. It arrives rain with late for the mid-Atlantic states. And then as we move into tomorrow, a rain-snow mix ends by early afternoon. Morning rain and storms in the Carolinas as this pushes away. We are looking for snowfall amounts anywhere from 1 to 6 inches of snow in some spots. These are the last snowfalls on record. Chicago, May 11th and 66. Pittsburgh, May 9th and 66. Boston, May 10th, 1977. So, guys, we still have a few weeks to go before we can finally say goodbye to winter.